Hi, and welcome to a brand new video to which we are going to talk about the impacted maxillary canines and their procedure of removal. So the impacted maxillary canines are quite common. Approximately 12% to 15% of the population presents with impacted canines, and these impacted canines is usually located palatally than labially, but even though positions vary, the impacted canine presents 5 basic localization. First is palatal localization. Second is palatal localization of crown and labial localization of root. Labial localization of crown and palatal localization of root. Fourth is labial localization, and fifth is the ectopic positions. And in young people aged 20 years or slightly older, impacted maxillary canines may be correctly aligned in the dental arch. This is after surgical exposure and orthodontic treatment follows. But in older patients that ages 30 years old or above, the procedure is not a method of choice because the risk of failure is higher. And in such cases, surgical removal is preferred if deemed necessary, of course. And the technique for removing the impacted canines depend on 3 things. First is the position of impaction, whether it's palatal or labial. Second is the relationship of the impacted tooth to the adjacent tooth. Third is the inclination of its crown. And it is important to note that these factors should be assessed before planning the surgical procedure so that we will have a high percentage of success. And the localization of impacted canines is achieved using various radiographic techniques together with careful clinical examination, such as palpating for protuberances on the area. And the most commonly used intraoral projections are occlusal projections, and second is the periapical radiographs and panoramic radiographs. And based on the data from the clinical and the radiographical examination, the surgical removal of impacted canines may be performed in 3 ways. And what are these 3 ways? First is with the labial approach, second is with the palatal approach, and third is for the combination of the both approaches. And let us start first with the extraction of the impacted maxillary canine using the labial approach. Okay, so for the first one, if the impacted tooth is localized labially and is entirely covered by bone, the procedure for the removal is as follows. First is let us look at the first picture. A trapezoidal incision is created, and the mucoperiosteum is then reflected. Here on the second picture, we can see that the mucoperiosteum is reflected. And then on the second one, the bone covering the tooth is removed using a round burr. On this picture here, using a round burr with a steady stream of saline solution until the entire crown of the tooth and part of the root are exposed. And on the fourth picture, we can see that separation is a groove is then created at the cervical line using a fissure burr in order to separate the crown from the root. Separation is achieved using a straight elevator which is placed in the groove upon rotation, and the instrument separates the tooth into 2 segments. Okay, here we can see on the next slide. Here, on the picture, we can see, on the first picture, we can see that this shows the sectioning of the crown to root at the cervical line of the tooth using a fissure burr. And on the second one, we can see the tooth after sectioning. On the third one, we can see the removal of the crown of the impacted tooth using a straight elevator. And on the third one is the root of the tooth after removal of the crown. And on the next slide, we can see that the purchase of point created on the root for replacement of the elevator blade. Next one is luxation of the root using a curved trumpet elevator, and the final step, which is the extraction of the root. And then on the picture here, we can see the two segments after removal. And on the next slide, the second to the last step that you are going to do is to smoothen the bone edges of the wound using a bone file. And the last one is the surgical field after suturing. So that's the steps for the extraction using labial approach. The fifth one is after the separation, the crown is removed first and the root is then luxated, and after creating a purchase point on the surface of the root for placement of the tip of the elevator blade. The last one is smoothing the bone and of course suturing the wound. When the impacted tooth is not entirely covered by bone, but the crown of the tooth is covered by overlying tissues, removal of the tooth is easier since it does not have to be sectioned into two pieces because the crown portion is not covered with, or the tooth per se is not entirely covered by bone. Okay, so the next approach that we are going to discuss is the extraction of tooth using the palatal approach. The palatal approach is used when the impacted tooth is positioned palatally, and the approach is achieved using a bilateral palatal flap. Okay, so the first thing that we are going to do is, I'm just gonna show you the pictures directly. Okay, palatal on this side, palatal incision along the cervical lines of the teeth are made. Second is the reflection of the flap. As you can see there, this arrow points on the protuberance of bone, which indicates the position of the crown of the impacted tooth. And the next picture here, we can see that the tooth is then, on this one, the tooth is then sectioned at the cervical line. So this separates the crown from the root. And the second one is the removal of bone using a round burr to expose the crown of an impacted tooth. Okay? The next slide is, the next step that we should do is first, the placement of a straight elevator in the groove created to separate the crown from the root and removal of the crown. Second is the removal of the root from its position in the bone using an angled elevator. And then the flap is repositioned in its initial position and pressure is applied to the area with the index finger for a few seconds. And for the very last step for all the oral surgery is the suturing on the surgical field. And that is it for the procedure of the removal of the impacted canine. And I hope that you picked up something from it and you learned something from it, and I'll see you on the next video. Bye!